Hey everyone, this is Libertarian Black Man. We are still fumbling around with healthcare today in 2018. After everything that we have done over the past 50 plus years in dealing with the healthcare issue, healthcare costs continue to go up at an astounding rate because we do not understand the basic principles of economics as a nation. One of those principles is that if you subsidize something, you're going to get more of it. So if you subsidize the consumption of healthcare services, meaning the government provides funds for people to use to pay for healthcare services, then you're going to get more people using those services and more consumption of medical services. Medicaid is an example. We have created this program to allow the poor to access medical care, and we spent $348 billion in 2017, or about 9% of the federal budget on this program. Many doctors do not accept Medicaid because Medicaid is only allowed to spend so much money. And if in fact it cannot spend more than the doctor's services cost, the doctor will say, sorry, I cannot provide you with health care because I'm only going to get 50 or 60% of it paid for, and I would lose money if I were to treat you. So doctors turn down those who are on Medicaid. State governments have to pick up the tab for 37% of Medicaid because the government the program is split between the federal and state governments as it was designed, where the state governments pick up 37% and the federal government picks up the rest. State governments have to expand Medicaid in order for there to be more Medicaid spending, and when many of these states have other programs for the people of their state to that they rely on, it constrains the government from being able to expand Medicaid, which makes it more difficult for the poor to use Medicaid to get services from healthcare professionals. Medicare is an even more expensive program, spending $702 billion, or 18% of the federal budget in 2017. This program is unfunded by $38 trillion over the next 75 years, and that comes straight from the Medicare Trustees Report, which shows the current value of estimated Medicare unfunded obligations. Here it is right here, $37.7 trillion unfunded obligations through 2092. It's divided up into three parts: Part A, Part B, and Part D. And Part A is $4.7 trillion in the whole, Part B $25.1 trillion in the whole, and Part D $7.9 trillion in the whole. So as it says here, in other words, it would take $37.7 trillion in current dollars to cover the cost of Medicare not funded through dedicated sources over the next 7.5 decades. 2018 report of Medicare trustees. Unfortunately, both sides continue to support this program that is unfunded by tens of trillions of dollars. And it doesn't matter if you're a Republican or a Democrat. The Democrats created Medicare along with Medicaid in the 1960s, and the Republicans expanded it more than anyone else in the 2000s. President George W. Bush created Part D, which added $8 trillion more in liabilities to Medicare back in 2003. And Medicare uses numerous sources of revenue to fund it because it is so expensive. It is still, however, not enough, which is why it's $38 trillion in the hole. These are your sources of Medicare revenues: payroll taxes, general revenues, beneficiary premiums, payments from state governments, taxation of Social Security benefits, which should tell you that something is very wrong when you have to take money from another program, from the benefits of people who are not even relying on the program in order to fund it. And then you have interest and other sources of revenue, paying for Part A, Part B, and Part D. This program cannot even survive on its own funding, so it has to take money from other sources. So as I said before, we have these guys here, Lyndon Johnson and the Democrats, creating Medicare on this date on this day back in 1965. President LBJ, Lyndon B. Johnson, signs Medicare bill. Here's President George W. Bush signing the Medicare Part D program into law, and of course making a big show of it to let people know he cares about the seniors, keeping our promise to our seniors. These are all Republicans who have said we can't spend too much money, but we're going to add $8 trillion of liabilities to a program that is already bankrupt. And when he signed it, he said it's giving older Americans better choices, that this is the greatest advance in health care coverage for America's seniors since the founding of Medicare. When Bush signed the Medicare Part D into law, it was the largest expansion of Medicare since the program was created in 1965. And it was projected to cost $400 billion. Of course, it's costing trillions of dollars. This was about paying for prescription drugs for senior citizens. And the people who are criticizing this are saying it is a giveaway to the drug makers and insurance companies. In fact, this is totally true, and all you need to do is go back and look at the previous paragraph. Because in the previous paragraph it says, in addition to the prescription drug benefits, the measure provides billions of dollars in subsidies to the insurance companies. They don't even try to hide it. They tell you this is tax money going to the insurance companies so that the insurance companies are able to be compensated for the services, for or so that they can pay for the healthcare services that they are in business to pay for. In fact, that is the very definition of a giveaway to the insurance industry. Tax dollars going into their hands so that they can pay for the prescription drugs and the higher cost of healthcare, which is being made higher because of this whole arrangement of subsidizing something that is being consumed. Obamacare is another government scheme to help people afford insurance and healthcare services, known as the Patient Protection and Affordable Care Act. It should be known as the Unaffordable Care Act because that was the only thing that happened to healthcare. It became more unaffordable during the time Obamacare was in place, and unfortunately it still is. It was supposed to make healthcare cheaper, but premiums have risen since 2010 when Obamacare was established. They've risen 36% since 2010 and 212% since 1999. So much for Obamacare decreasing the cost of healthcare services.
Some numbers here on the screen. We have employer-sponsored average annual premiums for single coverage. They've been rising since most of us remember, but we had a bar chart, and this was from a Kaiser survey, and it showed from 1999 to today, the annual premiums for a single person, 99 they were $2,200. Today, $6,896. It just seems like no matter whether it was before Obamacare was even a word or he was president, or, President Trump saying we've got to do something about it, you guys continue to raise your premiums on everybody, no matter what the sort of political outcome or feel of this country. At some point, don't you have to look at yourselves and say, this is getting ridiculous. Everybody notices now.
Look, we want healthcare to be more affordable, but it's important to realize what goes into the health insurance premiums. It's the underlying cost of medical care. It's the outrageous cost of prescription drugs. It's ever higher hospital prices. And that's really what's going into premiums. If you look at how much insurance costs, now 23 cents on every premium dollar in the commercial market is responsible from prescription drugs. I mean, these are the underlying issues that we need to tackle, and we are ready to work across the aisle to work with anyone to make healthcare more affordable.
The failure to bring the cost of healthcare down has nothing to do with working across the aisle. In fact, there's been a lot of working across the aisle on the issue of healthcare. The problem is not learning the basic economic principles of supply and demand. When you subsidize something, you get more of it. If you subsidize consumption of healthcare, you get more consumption of healthcare, and if you consume it more than you produce it, you're going to see higher and higher prices. And that is driven by local, state, and federal regulation through Medicare, through Medicaid, through Obamacare, through state programs, local programs, and the printing of money, which lays the groundwork for all of these programs. That's where our subsidies are coming from. We ban the imports of prescriptions and natural substances like marijuana. We don't allow foreign countries to import prescriptions that they make for much less than we do that do the same things our drugs do. We have the Food and Drug Administration, the FDA, in charge of approving drugs before consumers can access them. This is a years-long multi-billion-dollar process per drug that the pharmaceutical industry has to go through, which is why they charge such high prices for prescription drugs, because it costs them so much in order to get it to the market. If we want to solve our healthcare issue, forget about working across the aisle. Elect people who understand the principles and laws of economics. Abolish the FDA and Obamacare. These are regulations and agencies that only add cost to the production of medical services and insurance. Allow for the free trade of drugs. Allow people to buy any drug from anywhere, or grow or manufacture anything that they can get their hands on to treat any medical condition. Reduce and eventually abolish Medicare and Medicaid. All they do is subsidize healthcare services. And keep in mind, if you're a business and you know the government is going to give people money to pay for your healthcare services no matter how high of a price you charge, the incentive is not to cut costs, not to reduce prices. The incentive is to raise prices, because the higher you go, the more money you make, because you're getting a guaranteed money stream from the government to pay for the things you sell. In a free market, there's an incentive to cut prices, because cutting prices makes money. But when you know the government has your back, you're going to raise prices in order to make money. We need to restore the gold standard so we can limit the amount of money government can print, or legalize free market currencies, which would bring competition to the production of currencies and prevent inflation from forming, because businesses, banks would not have an incentive to devalue their currencies. We need to get rid of government-mandated licensing for medical professionals and facilities. This adds enormous cost. If you're trying to get into the medical field and you have to pay hundreds of thousands of dollars just to get the training, you're going to have to earn hundreds of thousands of dollars in order to continue practicing. Otherwise, there would be no incentive to become a doctor or surgeon or nurse if in fact you're going to have to pay $200,000 and you're only making $20,000 a year. It is all about the cost of getting into an occupation that will also drive the cost of practicing in that occupation. In my book, Say No to Big Government, I talk about medical licensing, the FDA, prescription drugs, why the bans on importing drugs only decrease competition and lead to higher drug prices, and why the government should not be involved in the medical sector. We should not print money, because ever since we started printing money, we saw healthcare costs skyrocketed. It was going up at about 7% a year from the 1940s to the 1970s. After we left the gold standard and began a printing spree, we saw the cost of healthcare rise over 20% a year, and it continues to rise at that level today. So for those who want to know why healthcare should be dealt with in a better way, please get my book, Say No to Big Government. Subscribe to my YouTube channel, Libertarian Black Man, and my Twitter page, libertarian black man, and we hope to see you in the next video.